Hey y'all, this week let's talk about fundoscopic exams. Have you ever been in clinical looking through an ophthalmoscope with your preceptor and they ask you if you saw what they saw? And you're like, yeah, as you're nose to nose to a patient. So, what are you really going to do at this point? Well, I'm going to discuss some tips for the fundoscopic exam so that you can understand it a bit better. So the next time you can actually see what they see. So here's an image of a normal eye as you're looking through an ophthalmoscope. I got this from Stanford Medicine as I thought it was a great image. So you see everything here, the optic cup, the optic disc, your veins, your arteries, your macula. And I really want you to pay attention to certain things, okay? Because this is your reference point. So veins, as you can see, are larger than the arteries and they're darker when you look at it from this standpoint. And then the optic cup and the optic disc ratio is important as well. You do not want that optic disc to be over 0.8% and ratio larger because that can give you an indication of glaucoma. Now that you've seen the normal eye, I want to go over some of the common things that you may see in practice as well as boards. This image comes from the University of Michigan, also a great image. And this is a picture of AV nicking of the eye. So it's simply what it says. The arteries are nicking the veins. And this comes from secondary to having hypertension uncontrolled for a long period of time. But if you will look, you'll see where the smaller arteries are overlapping the veins and causing it to nick and separate and bulge. So here is another common eye abnormality that you may see. And this is cotton wool spots, another image from the University of Michigan. Cotton wool spots are secondary to diabetes. Also, hypertension can cause this, but it's most commonly caused by diabetes. And you can see it looks just as the name sounds, cotton wool spots. So those white patchy areas that look like cotton are the actual spots. And these are easy to identify when you start to see them. And this is a severe case, I should say, but you'll be able to notice it. And what happens is those nerve fibers are damaged and they begin to feel, and that's how they look after the damage has occurred. And one last image I also wanted to go over, and this comes from Stanford Medicine. This is diabetic retinopathy, so okay, secondary to diabetes. But what you can see, because you'll commonly hear it called microvascularization, following your terms, the vasculature, the vessels are micro, so they're smaller. And if you review back to what a normal eye looks like, look at these vessels. They're so tiny. And so you'll be able to see those as well. So be sure that you're able to identify these type of eye conditions. As always, be sure to like, subscribe, and share.